Wow. A simple cough like this over 2 years ago would not have aroused any suspicion. But now, if you dare cough inside the bus, everybody does what? Quickly adjust their mask. Why is this? It's simply because of COVID-19. In the past 16, 18, 19 months, COVID-19 has spread from Wuhan, China, to across the globe. And as we speak, we have over 111 million global cases, with over 1 million deaths recorded so far. And this pandemic has given rise to a lot of speculations, lots of misinformation, fake news, and lots of talking points. I personally, even though I'm not a medical practitioner or a scientist, I've seen lots of theories and conspiracies which are laughable. But in this video, I went out once again on the street of Istanbul to meet up with a professor who happens to be a medical practitioner and table some of these misconceptions and questions and sample his opinion. Now I have to say that this video is going to be a bit long, but I hope you are going to learn one or two things from my talk with Professor William Mosier.
Is it a scam? You're asking me if COVID-19 is a scam produced by the media. No, it's not a scam. Oh my goodness. My jaw drops every time I hear one of my graduate students, I mean, not undergraduates, but graduate students, people who are supposed to be smarter because they're in graduate school, and they'll say that. And I say, what do you watch on social media? No, it's not a scam. It is real pandemic that was caused by bat dung falling on the animals that lived in the bottom of a cave that happened to be an animal that looks kind of like an armadillo, an American armadillo. And that particular animal is eaten by poor people, or some people see it as a delicacy in the open markets in China. So in Wuhan, one of those animals happened to be filled with the coronavirus, and there must have been some human who had a weak immune system, and the virus jumped onto that person, and that started this global pandemic. That is uninformed individuals who say that, not people who understand microbiology and pathophysiology and virology. No, it was not manufactured in a lab. The United States has a lab in China that it shares with the Chinese government. In fact, I've been there. It's run by the Department of Defense to make sure we can have defenses against certain kinds of infections. But the kinds of infections that we experiment with is malaria, how to control malaria, how to control dengue fever, not how to create a virus that's going to kill people. Not at all. The deaths from COVID-19.
Yes.
You're asking.
A lot of figures, yes.
Oh my goodness. Yes, they're real figures. Yes, people have died from this infection. But just because some people die from the infection, that does not mean Anybody can die from the infection. One's immune system has to be compromised to die from COVID-19. This particular virus, this unfortunate virus that has infected the planet, will not kill everyone, and eventually people will have an immunity to this virus. The issue is that people who are overweight, who have heart disease, who smoke cigarettes, who are heavy drinkers, who have cancer, these are the people who are at risk if they have older lungs. What do I mean by older lungs? People who've been alive over 65 years. I wrote a journal article on this subject. The World Health Organization keeps track of who dies from this virus. 86% of the deaths are people over 65. The few, that small percentage of people, that 15% of people under 65 who died, have been people who had compromised immune systems already. They were HIV positive, or they had cystic fibrosis, which is a pre-existing lung disease that fills fluid, puts fluid in the lungs. And people who were chain smokers, like the one physician in New York who was working in an emergency room and caught the virus. The media doesn't talk about the fact that this primary care provider died from the virus because he was a 2-pack-a-day smoker. So his lungs were compromised. Yes, he was only 55, so that he had a reason for being younger than 65 and being at risk. It was not he was at risk because he was a healthcare provider. That's malarkey, because most healthcare providers do fine even if they catch the virus. No, that is not true. The definition of a pandemic is set by the World Health Organization, which is an entity that works within the United Nations. The World Health Organization works together with the health ministries of all the countries that are members of the United Nations, and we come together and make an agreement on what constitutes a pandemic. This was a pandemic, just as the SARS epidemic could have been a pandemic if it wasn't controlled. Fortunately, it was controlled. The one at the early part of I guess it was around 2002. And the Ebola outbreak could have become a pandemic if it wasn't controlled. The sad thing is, this one isn't as dangerous as that first SARS virus or Ebola. Subsequently, it could spread more easily. No virus wants to die. The goal of a virus is to stay alive. So it wants me to cough on my hand and then shake your hand so that I can give you the virus, because it wants to keep breeding. But a virus is so much smaller, you need an electron microscope to see a virus. You might have already heard the news that a study was done to see how much virus has escaped in this world. This global pandemic has been caused by a number of virus that could fit inside a 12-ounce Coca-Cola can. Lack of economic drive. There wasn't a motivation. In the first place, we already do have excellent treatments for AIDS. Magic Johnson got AIDS, and he's still alive and a healthy millionaire. So we do have effective treatments for AIDS. To say prevention of something like AIDS, well, that's a bit complicated because it came from a monkey to humans who were having, this is probably G-rated, so I can't say probably on this, how the first transmission from monkey to human occurred by some Americans who went to Africa and had some kinky activity with a monkey and then contracted the AIDS. So when you say, why are there other conditions that we don't have cures for? Well, it's specifically because there hasn't been adequate urgency. That's why people like Bill Gates has a foundation that works on trying to find a cure for malaria. Most people in Africa don't get malaria. It only attacks people with weak immune systems. And so, sadly, until someone makes a commitment to put money into finding a cure is slow in finding. A good example is dengue fever. We know there's a particular mosquito that all over the world can produce dengue fever. Well, most people don't die from dengue fever. They just get horribly sick. But there is a small percentage of people who do die from dengue fever. That is why the U.S. military medical department and the World Health Organization spend so much money on trying to find a cure for dengue fever as well as malaria. Bill Gates is very close to finding a cure for malaria. The problem is, in answering your question, is because it takes money, and sadly, too many capitalists don't like the idea of spending money to help the percentage of people who die. The clinical process that the media obsessed on about being short was not so short that it ended up compromising the efficacy and reliability of the medications, the vaccines. It's just, sadly, the media wanted something to talk about, so they talked about how this went faster than typically occurs. But the reason it went faster is because Bill Gates's money from his foundation was freely given to speed up the process, but in a regular, methodical way that we do in science. So there was no shortcuts whatsoever. And we know from the Oxford University, it keeps getting called the AstraZeneca because that's the name of the drug company, the pharmaceutical company that financed it. But it was done at Oxford University, the most famous, well, arguably the most famous university in the world. So the studies of all of the 6 vaccines have been done meticulously. The little caveats are related to things like the Russian one didn't take precautions against people who might have AIDS. So a person with AIDS might not have a virulent response to the vaccine. But other than this little small issue with the Russian produced virus vaccine, all of them are very safe.
Is it true?
I love to laugh, and I was not expecting that question. No, it's ridiculous that that this global pandemic was just a sideshow to cover up implementing some international scam. No, the rich people don't care about the rest of us. They're already rich. They don't give a damn about you and I. So no, this is a sad reality that we're going to continue like we had 100 years ago, a pandemic, the Spanish flu. Tragically, it was called the Spanish flu just because they noticed the first patients came out of Spain. In modern times, it's just two smacks of bias to relate it to a country. So that's why we don't call this the Chinese virus. That was just the foolish misspeak by Trump. The virus that has happened now was a fluke. Just as if we're not more diligent about searching for ways to protect humans from zoological pathogens, that is, animal-borne infections that then skip to humans, we're going to have another pandemic.
A lot of pastors, a lot of people have spoken against taking vaccines. So should Christians?
What do you mean, a lot of
yes,
Christians?
There are videos of pastors
on social media.
Yes.
Okay, that doesn't mean a lot. This is a problem about social media. People think that if something has been published on social media, that means it's a big deal. It's not. No, any sane human being understands enough about their high school chemistry to realize that the vaccine should be taken by everyone. So when you ask a question like, should a Christian take it? I'm floored because this isn't a disease of Islam or Buddhism or Hinduism or Judaism or Christianity. This is a disease of humanity. And whatever word we want to use for God, Allah, the architect of this universe is my favorite phrase. The architect of the universe gave us a brain to be able to think rationally about things. And so it's absurd for any pastor who maybe only went to Bible college, who doesn't have a graduate degree in science, to tell people that the vaccine is unsafe. That's absurd. Yes, I've heard that one. I've heard that one too.
Is there a relationship between COVID-19 and evil spirits?
No. Well, no, there's no relationship between COVID-19, which is a pathogen in microbiology, and spirits. In the first place, evil spirits don't exist. So that's kind of an absurdity. It's just unconscionable for my brain to fathom how a person would think that a microorganism that you can only see with an electron microscope is somehow being controlled by the devil or something. It just, that just isn't how nature works.
It's with us.
Okay, I tested positive for the virus back in, I guess it was August. And because I'm a vegetarian, I don't smoke or drink, I have an active, healthy lifestyle, it attacked me just the same way the regular cold that we get attacked me. I don't have a compromised immune system, and so I just had 3 to 5 days of yucky, uncomfortable feeling, and then I was fine again. They still forced me to stay in quarantine for 14 days, so I couldn't infect others, but after 3 to 5 days, I felt my old self again.
It's in what
You don't have to do anything because of your age. You're so young, you won't die.
Generally, not me.
Well, but the only people that die are people who have compromised immune systems, and typically that means people over 65. But remember, there was a nun in France who got COVID-19. She was 118 years old, and she was recently released from the hospital. So there are scores of septuagenarians, people over 100, who have caught the virus, but they live a healthy lifestyle, and so they just went through the protocol and then were discharged from the hospital. The people who are at risk are the people who smoke, who already have a pre-existing diabetes, heart disease, God forbid, cancer. Those are the individuals who won't have an easy time fighting this off. My sister, my oldest sister, she died during the pandemic of COVID. Why? Because she had cancer already, breast cancer. And so she had a compromised immune system. But she was my older sister. She was over 65. So again, the individuals who are at risk are not people like you and I. It's people who have health issues anyway.
So if I have COVID-19 now, I don't need to do anything?
Well, yes, there's 2 things you need to do. 1, social distance yourself from any elderly people and wear the mask, because you have to wear 3 masks all at the same time. I'm saying 3 masks at the same time to be able to block the virus, because it's so tiny, coming into your face. Let me run that past you again now. 1 mask cannot protect me from you if you have COVID-19. The mask wearing is to protect others, senior citizens, elderly people, in case I am a healthy carrier. That's what it's for. So the only way that if one's obsessed with protecting themselves, they need, the World Health Organization did a study on this through several universities. Even the Department of Public Health, Secretary of Health in America mentioned this, that if one is really concerned about protecting themselves, you need to wear 3 masks. But that's not practical, right? So don't think about it. Just think about not infecting senior citizens who might be at risk because they have diabetes, heart disease, some terminal illness that they're not even aware of, or a compromised immune system.
All right, final question. I hope you love this interview. If you have any question for the professor, please put them in the comment section below and I will try as much as possible to get those answers for you. Thank you guys for watching. If this is your very first time watching, please do us a favor. Click the subscribe button and make sure you leave your notification bell turned on so you get notified each time we post a new video. Don't forget that our family giveaway is still on. What you need to do is click the subscribe button, like our videos, comment on all our videos, and you stand a chance to be the lucky winner.